Well, hi everyone, it's Dr. Schroder with this week's video introduction to week number 4 of our course in this introduction to professional nursing. And we're kind of getting towards the latter part of class. You've only got a couple weeks left. So congratulations, everybody is doing well. You're all keeping up and everybody is doing exactly what you need to do. So you're probably starting to feel a little bit more comfortable, a little bit more confident. You're starting to feel, hopefully, like you can do this, and like this is something that you can plan your, you're learning some time management skills. You're learning how to plan things out, and especially since you got that first big paper out of the way and got feedback on that, you've got a little bit of an idea on kind of where you need to go from here. So everybody's doing great. Everybody's keeping up. Everybody is doing outstanding. So in week number 4, let's see, in week number 3, we talked about, primarily it was conflict. And we're going to talk about this topic again going into week number 4. Week number 3, we talked about sort of like our interpersonal conflicts and how we handle communication, multidisciplinary communication in particular, communication with fellow peers and other healthcare practitioners. And this week we're going to take it one step further and talk about conflict and how conflict is handled. This is also, we're going to be talking about content that you're going to be using for your final paper. Your final paper is the meeting that you're going to attend. You're going to be assessing that meeting and discussing how you see conflict handled and how you see communication occur in this meeting. And so this week's discussion is geared to kind of help you with that a little bit. You're going to complete something called the Dutch Conflict Inventory, or the Dutch Conflict Assessment. And it really is geared for those of you that are working, and if you're not currently working, particularly if you're not working in healthcare, think about a place where you have worked, where you can apply that, those principles, or apply that assessment. And that's going to be your discussion question this week. Also, there's no writing assignment this week. Last week you did your writing assignment on the coming up with an outline, and I gave several of you some feedback on the outlines. You'll be getting grading feedback on it as well this week. And remember, it's this whole concept of writing is a process. Please, if you haven't done so already, review my materials that I posted on sort of the tips and the keys for writing a perfect paper every time. And if you can just remember to start with the outline, use the outline as your basic template, sort of that framework that you use. And if all else fails, just start to write. Nothing gets done unless you actually sit down and start writing. Sometimes it's when we start to write just absolute garbage that we decide that, that this looks good, that looks bad, or it looks better. And so we can go back and change what we wrote. Don't ever think of your first draft of a paper as your final draft. Always think that when you're typing a paper, you'll go through, you'll write the paper very rough, and that's not what you're going to turn in. What you're going to turn in is you're going to go through that paper afterwards and then check your spelling, check your grammar, make sure that it makes sense, make sure that it's logical, make changes as you need to. You should be spending about half of your time actually in the development writing phase, and then half your paper writing time going back through and reviewing, revising, editing what you have. That's kind of a little rule of thumb. You're going to actually usually, most writers spend much more time refining and editing than they do actually writing the document itself. So just some things to keep in mind as you go through and prepare for that final paper you're going to be writing in class. This week you're going to be also turning in an outline for your professional topic presentation. Please review the syllabus for that. What is going to be due this week is you're essentially just going to be going through and completing an outline, where you're going to outline out a topic that is of interest to you. And it's pretty wide ranging here. You have quite a bit of leeway into exactly what it is that you want to go ahead and focus on, what it is that you want to do your study on. But you're going to be or excuse me, do your PowerPoint on. But I will be posting some information about PowerPoint later this week. If you haven't done a PowerPoint before, the good news about PowerPoint is one of the easier programs to learn and to master uh, compared to all the other Microsoft programs. It is not quite as daunting and complicated as, say, like Word can be or Excel. You are going to be recording your voice. You're not going to be recording yourself like I'm doing here on video, but you will be recording audio, and that is going to serve as like if you were in front of the class giving the presentation. What would you be saying in front of the class? What would you be saying? And you're going to be recording the audio into the presentation. So I'll talk a little bit more about that this week. And of course, as you have questions, please feel free to let me know. Um, the topic can be anything that you find interesting. The idea is not to do like a teaching demonstration, and in other words, this isn't a um, presentation where, for example, you're going to teach us how to start an IV or something like that. It's not that kind of a presentation, but rather you might want to pick a topic. What is interesting to you? Maybe the nursing shortage or how to deal with the nursing shortage. Maybe challenges the nurses have in the all the healthcare changes that are happening right now. That would be a particular topic. Um, should the RSN be required or is the ADN adequate? That may be another topic. Um, you may want to talk about something specific to professional practice. Maybe you work in the emergency room or work in a specialty area and you want to discuss some topic pertinent to that area. Reducing restraints, for example. Those are all topics that would be fine and appropriate. That's why I want you to do the outline, is because I want to kind of get an idea in the outline just to see what information you're going to have. When you're doing the outline, things in terms of what is going to be on each slide. You don't have to have a lot of content necessarily, just what is the topic that you're focusing on, what are your objectives. You'll see that there is a link in here for tips on writing behavioral objectives. What is it that you want your audience to be able to do after they're through with or after they view your presentation? I'll talk more about the posting of the presentations and how you're going to be reviewing each other's presentations. We'll talk about that a little bit more next week. But that's pretty much, I think, covers the week this week. So just like to pray and say, Dear Lord, thanks for just keeping us all together. Thanks for keeping us sane. Thanks for keeping us happy and healthy. And be with us this week as we struggle to always overcome all of our challenges. Thank you for bringing us to this point in the program. Thank you for bringing us together. Be with us in the class and the discussions this week. As we pray in your holy name, amen. And amen. And with that, I will see you in the discussion questions this week. As you have questions, please feel free to post them, and we'll see you in class.